In a bid to tackle the rising cases of maternal and neonatal deaths in Nigeria, the federal government has partnered with the Oyo State Government under the Maternal and Neonatal Mortality Reduction Innovation Initiative. The collaboration, through a 5-day workshop, seeks to develop sustainable strategies and engage key stakeholders in identifying and addressing factors responsible for the menace in the state.
Nigeria ranks among the countries with the highest maternal and neonatal mortality rates in the world, recording about 75,000 maternal deaths annually due to pregnancy and childbirth, and a neonatal mortality rate of approximately 41 deaths per 1,000 live births between 2023 and 2024. To address this menace, the federal government, through the sector-wide approach initiative, organized a 5-day workshop to engage state actors in Oyo State and other stakeholders in charting a way forward on the problem.
Prior to the ministers coming to office, there were a lot of issues of maternal. It was very high. He sat down, and looked at had the census and checked, and so that is something that we cannot continue doing, right? How do you continue doing the same thing and expect a different result? So that's what even brought about the design of the Nigerian Health Sector Renewal Investment Initiative to be driven by using the SWAP approach.
Under this initiative, 172 local governments were identified nationwide, including 4 in Oyo State, where maternal and neonatal mortality rate is most prevalent. As part of this event, participants will visit these local governments to identify their specific challenges and profile solutions.
So we are coming together today for this 1 week to know what is going on. We want to see, okay, what is causing maternal mortality? We go to our communities to find out. We visit some people to know, like a group discussion interview, to know what is going on, what are the things that we need to look into. Is it delay in taking decision? Is it delay at the hospital setting? Probably we get to the hospital and find out they need to have certain equipment.
Then we move into the community to interview the community gatekeepers, the WCDC, the CDC chairman, the traditional people over there, the religious leaders. We are going to interview them to also deep dive on what is causing this maternal death.
The workshop is expected to strengthen collaboration between federal and state actors, healthcare providers, and community stakeholders toward achieving safer pregnancies and childbirth. Olaide Oyewole, TVC News, Ibadan.
Olaide joins me now for more on this development. So what happens after visiting these healthcare centers when they find out the challenge for neonatal crisis? What is the action point, Olaide?
So, of course, after going to these local governments and communities where this kind of menace was identified, they are going to, now plan actions that will bring about the change they want in these various communities. So, if you look at the maternal mortality rate in Nigeria in the last 3 years, you will see that it is very, very, very appalling. So about 993 deaths per 100,000 deaths in Nigeria. It means that if about 100,000 persons give birth, there is tendency that 993 of them would have 993 mortality rate amongst them. So because of the federal government came about the maternal and neonatal mortality reduction innovation and initiative. That's the MAMI project, which is aimed at reducing this menace in the various localities in Nigeria. So because of this, they had to partner with the various states. Now, through this initiative, about 172 local governments were identified across Nigeria, and they took this workshop to the various states where this menace were identified. So after the workshop, they are going to visit some of these communities, ask them questions. What is the reason for this skyrocketed rate of maternal mortality rate? Is it because you do not have enough healthcare workers? Is it because there are not enough facilities to work? So after identifying all of these things, they'll now come to the round table and provide solutions to all of these issues so that we can have a reduced rate of maternal mortality and neonatal mortality in Nigeria. Nefemi.
Well, I guess we'll see how that plays out. Olade Oyewole live for us in Ibadan. Thank you for the updates there.